Lecture for second-year students of the third semester of the Faculty of Dentistry. Methods of examination of the patients. Tools for examination and treatment of a dental patient. The purpose of clinical examination is an accurate diagnosis of the disease, which is necessary for successful treatment. To confirm the initial diagnosis and differential diagnosis, a general and systematic examination of the patient is carried out. In dentistry, different methods are used, which are divided into the main ones and additional methods. The main methods are the questioning of the patient, or collecting anamnesis, the questioning of the close relatives of the patient if it's necessary, and the examination or inspection of the patient. And additional methods are the electrodontic diagnostics, electromagnetic diagnostics, X-ray diagnostics, laboratory methods, and functional research methods. First stage is the questioning of the patient. The questioning begins with the clarification of complaints, which often allow you to immediately suspect a particular disease. You can ask questions, but it's better to ask the patient to tell him what bothers him at the moment of the appointment, and what are the first manifestations of the disease, the causes, and the pain. A large number of popular medical literature are advertising and make patients more informed, and the answers can be filled with diagnosis of various diseases, but it is not the diagnoses which are important here, but subjective sensations of the patient. So if the patient tells you that he has a repetitive pain, that's not really informative for you, and instead you should ask him what does he feel, not what did he read in the internet or in the book. So, as for the informativeness, there are complaints of the main and secondary value. And the main complaints are the important symptoms of the disease, which indicate a certain extent and localization of the process. Secondary complaints are the patient's feeling, indicating only the presence of a disease without a certain specificity, or complaints which are associated with the current disease. So what are the most predominant complaints of the patients? First of all, there might be no complaints at all, but this doesn't mean that there is no trouble in the patient's health, because the asymptomatic course is characteristic of some stages of caries and chronic diseases of periodontitis in remission. Sometimes the patient might complain on the changes of position, size, shape, and the color of teeth, which are the characteristic of non-carious lesions of the hard tissues of the teeth. Sometimes the unpleasant sensations may be associated with chewing, ingestion of food into the interdental spaces with a defect in fillings or artificial crowns, dystopia of the teeth with their mobility. Toothache can be different, and depend from the temperature, cold or hot, the chemical, sour or sweet, and mechanical stimuli passing after the elimination is the characteristic of dental caries. Pain in the tooth from any irritants that persist after the elimination, spontaneous pain, paroxysmal pain at certain times of the day, with irritation around the branches of the trigeminal nerve, or without it, means that there is inflammation in the tooth pulp, or sometimes might be evident of neuralgia. Pain in the tooth of varying intensity, arising or intensifying with mechanical stress, informs us of the inflammation of periodontium, and thus meaning the periodontal disease. The bleeding gums also mean the inflammation of the periodontium of varying severity. Tooth mobility shows us the inflammatory periodontal diseases, a symptom of hyper and avitaminosis, diabetes, trauma, diseases, and chemopolytic organs. Pain in the oral cavity and inability to eat sometimes might show us the diseases of the oral mucosa. The dry mouth can show us the diseases of the salivary glands. Increased salivation means that there might be a true hypersalivation, false hypersalivation. Bad breath or halitosis appears with inflammation of the gum margin, but sometimes can show us somatic diseases with the chronic inflammation of tonsils or the gastrointestinal tract, and violation of taste. A decrease, absence, or perversion of taste sensations can lead us to a consequence of damage to the central nervous system or a change in the receptor apparatus. Next stage is taking the history of disease. So for diagnosis, it is important to know when the symptoms of the disease appeared, its first manifestations, and the onset of the disease. When describing the history of disease, you should not use phrases which are acceptable in the everyday speech for people who are not related into the medicine, like hole in the tooth or etc. These phrases should be replaced by the equivalents, like the carious cavity. Sometimes, to clarify the patient's complaint, a literal statement of the patient's words is necessary. In such cases, they are encoded in quotation marks, and this indicates that these words belong to the patient. Sometimes it's important to find out what diseases the patient suffered starting from the childhood, and what consequences are from these diseases. Sometimes it's some wounds, operations, contusions, some sexually transmitted diseases, tuberculosis, mental illness, and poisoning, which can also give some information to us. And some of these diseases have their own showing in the mouth of the patient. Allergy history. Since there's a significant increase in the number of diseases which are based on hypersensitivity to drugs, food, or other reactions, we should always collect the allergical anamnesis of the patient. It helps in clarifying the diagnosis sometimes, and it should be taken into account when prescribing medications and making anesthesia. There can be different types of history: the household history, the labor history, bad habits, oral hygiene, and these are all important because sometimes by defining, for example, the labor of the patient, we can determine on some diagnosis. The objective survey or objective examination includes examination, percussion, palpation, and a number of additional studies. So the purpose of the examination is to identify changes in the maxillofacial region when seeking help or in the process of medical examination. The examination schematically consists of an external examination of the patient and examination of the oral cavity with good daylight or artificial lighting. The external examination, attention is paid to the general appearance of the patient, the presence of swelling, asymmetry, and formation of the red borders of the lips. If the patient complains of a change in the mucous membrane of the mouth, we should always carefully examine the skin. With complaints of pain in the mucous membrane of the nose and eyes, we should examine them, and in some diseases, for example, with pemphigus, there may be damage to the mucous membrane of the mouth, nose, and eyes. Next is the examination of the oral cavity, which is also divided into some parts. The examination of the oral cavity begins with the vestibule of the mouth, with closed jaws and relaxed lips. And first, the red border of the lips and the corners of the mouth are examined. We pay attention to the color, the formation of scales, crusts. On the inner surface of the lip, there can be a slightly bumpy surface, due to the location of small salivary glands in the mucous layer. In addition, you can see point holes, the accessory ducts of these glands. At these holes, when fixing the mouth in the open position, you can observe the accumulation of the droplets of saliva secretion. Then, with the help of the mirror, the inner surface of the cheeks is examined. Along the line of the closing of the teeth in the posterior section, there are sebaceous glands, which are called the Forsyth glands, which should not be mistaken for pathology. These are pale yellow nodules with a diameter of 1 to 2 mm, not towering above the mucous membrane and sometimes visible only with tension of the mucous membrane. The bite of the patient. An important role belongs to the determination of the ratio of dentition, or we can call it the bite or occlusion. There are temporary, replaceable, and permanent bite. The temporary bite is presented by 20 teeth, which differ from permanent teeth in size, shape, and color. Replaceable bite is a bite when permanent teeth begins to appear in place of the primary teeth. In the replaceable bite, simultaneously with already erupted permanent teeth, the primary teeth continue to function, which are gradually replaced by the permanent ones. This period lasts from 6 to 7 up to 12-14 years. A permanent bite is formed when 32 permanent teeth erupt. In the dentition, the teeth are slightly adjacent to each other with their lateral surface, or contact points as we call them, and each tooth contacts and closes with the two lower antagonists, with the exception of the lower central incisors and upper third large molars, or wisdom teeth. When closing the dentition rows, the upper incisors are overlapped by 1/3 of the height of the crowns. The cutting edges of the lower incisors rest on the dental tubercles on the palatine surface of the upper incisors. The buccal tubercles of the lateral incisors overlap the corresponding tubercles of the lower teeth, and the upper canines, when closing the teeth, fall between the lower canines and the first premolar. The medial buccal tubercles of the upper teeth and the upper large molars are laid in the arterial grooves between the buccal tubercles of the lower first molars. In significant number of people, the wisdom teeth do not erupt due to the absence of their rudiments. This means that only 28 teeth erupt. The varieties of occlusion. Varieties of normal permanent occlusion are the physiological prognathia, the moderate stenting of the anterior position of the upper jaw, the physiological progenia, the moderate stenting of anterior swelling of the dentition of the lower jaw, direct bite, the marginal closure of the incisors and eponymous tubercles on the upper and lower lateral teeth, and biprognathia, simulational deviation forward of the upper and lower front teeth. The designation of teeth is carried out according to the International Digital System. So, in permanent and temporary teeth, there are different designations of teeth. So, when we talk about the temporary teeth, the maxilla is divided into two parts, and the mandible is divided into two parts as well. So, all of the mouth is divided into 4 parts. If you look at the patient, then his right side and right side of the upper jaw is numbered with number 5. The left side of the upper jaw is number 6. The lower left is number 7 and lower right is number 8. And after this number, we add another number which corresponds to the number of tooth. So for example, tooth number 52 is the lateral incisor on the upper jaw on the right side. And in permanent teeth, it's almost the same, except that the upper right region of the mouth is number 1, upper left number 2, lower left number 3, and lower right number 4. So if you want to say second premolar on the lower jaw in the left side, then we will say it's tooth number 35. Examination of the temporomandibular joint. This begins with determining the range of motion of the lower jaw. The limitation of mobility can occur due to inflammatory muscular contracture, ankylosis, and different inflammatory diseases. Also can be happening as a result of mechanical restriction of movements due to the fracture or The fracture of the lower jaw. In children, excessive mobility of the lower jaw is possible with overstretching of the ligamentous apparatus of the joint. And when the lower jaw is displaced at the time of opening the mouth on the one side, the doctor should look for a pathological focus in the artificial process or medial tigroid muscle on the side opposite to the direction of displacement. The examination of the gums. The gum examination parameters are color, turgor, and puffiness of gums, hypertrophy or atrophy of the gum papilla, violation of integrity, the presence of ulcerations, bleeding during probing, the presence of pathological gingival pockets, and normally the gum of the pale pink color tightly covers the necks of the teeth. The gingival papillae are pale pink and is occupying the interdental spaces. If there is some disease, then the epithelium of the gum terminates along the root, forming a periodontal pocket. When examining the gums, this type of inflammation, the nature of course, prevalence, severity are determined. So you can see in the picture, the upper picture, the normal gum, and in the lower picture there is inflammation in the marginal region of gums, which is shown with the red bright gums. The periodontal examination. Examination of periodontal tissues is carried out by probing to detect bleeding, supra or subgingival tartar, and periodontal pocket using a button probe. The load of the periodontal probe during the examination should be no more than 25 grams. Practical test to establish this strength is pressing the periodontal probe on the nail of the thumb without causing pain or discomfort. On the gums, swelling of various shapes and consistencies can form. The most common abscesses are a sharply hyperemic area of the gum mucosa with an accumulation of purulent exudate in the center. After the opening of the abscess, a fistular passage occurs. So you can see in the picture here something looking like a periodontal abscess with some hyperemia, and if you see this, you can suppose that there is some periodontal disease in the patient. Then the examination of the oral cavity itself. So we examined the gums and the vestibular portion and the cheeks. Now we proceed to examination of the oral cavity itself. First of all, the examination of the tongue. It begins with determining of the condition of the papilla of the tongues, especially if they are complaints of change of sensitivity or burning or soreness in areas. And there may be a relaxation of the tongue due to slowdown in the rejection of the internal layers of the epithelium. Sometimes there is an increased desquamation of the papilla of the tongue in some areas, usually on the tip and lateral surface. This condition may not bother the patient, but pain from irritants, especially chemical ones, may occur. Individual areas, and sometimes the entire mucous membrane, can be bright red or crimson in color. This condition of the tongue is observed by malignant anemia and is called melarglossitis. Hypertrophy of the papilla may also be noted, which is not cause concern to the patient, and is often combined with hyperacid gastritis. When examining the tongue, it should be remembered that at the roof of the tongue and on the right and left there is lymphoid tissue of pink or bluish color. So this is normal. When examining the tongue, pay attention to its size and relief of the tongue. When an increase in size, it is necessary to determine the time of the manifestation of this symptom, and it is necessary to distinguish macroglossia for edema. The tongue can be folded in the presence of many longitudinal folds, but patients may not be aware of this, since in most cases this does not bother them. Folding is manifested when the tongue is straightened. Patients take them from cracks. The difference is that with a crack, the integrity of the epithelial layer is violated, and with a fold, the epithelium is not damaged. The examination of the floor of the oral cavity. So the patient is putting his tongue up, and attention is paid to the mucous membrane of the floor of the oral cavity. Its peculiarity is malleability, with presence of folds and phloem of the tongue, and accessory ducts of the submandibular and sublingual salivary glands. The examination of palate. The mucous membrane of the hard palate is dense, and in the anterior section, pinholes of the accessory ducts of the salivary glands can be seen, and sometimes droplets of accumulated secretions. In smokers, the mucous membrane may occur amethylint. In the presence of keratinization, which is manifested by a grayish-white area and adhesion to the underlying tissues, the level of elevation of the focus above the mucous membrane and soreness are determined. If any changes are detected on the mucous membrane of the mouth, it is necessary to exclude or confirm the possibility of traumatic factor. This is necessary for the diagnosis, and if the cause is determined, then it's important for the treatment. It should be remembered, however, that the detection of trauma to the mucous membrane with teeth or prosthesis is possible in a state of physiologic position of the lower jaw and tongue. Otherwise, when opening the mouth, especially full, there is significant displacement of the tissues on the cheek, tongue, and its position, and injured area may not come into contact with the edge of the tooth of prosthesis. So, if the mouth is opened wide, and if the patient complains on the trauma due to prosthesis, the mouth is opened wide and you take the prosthesis off, and the site of the trauma is not corresponding to the factor which is causing the trauma on the prosthesis. Examination of teeth. Teeth are examined using a number of tools, which are most usually the dental speculum and probe. The speculum or mirror allows you to inspect poorly accessible areas and direct a beam of light to the desired area. And the probe checks all the depressions, pigmented areas of the teeth, and the integrity of animal is not violated. Then the probe slides along the surface of the tooth. If the integrity of animal is violated and there is a carious cavity, the probe is retained in the carious cavity. Especially carefully, we should inspect the surfaces of the contact of the teeth, the contact points, since it's not easy to detect the cavity there. And the technique of translucency of tooth tissues, which is bringing light through the spectral light, we can use this technique to determine the cavities on the contact point. The color of the tooth can make a difference in diagnosis. Teeth are usually white with many shades from yellow to bluish. However, regardless of the shade, the enamel of the healthy teeth is characterized by its special transparency. In a number of conditions, the enamel loses its shine and becomes dull. So the beginning of carious process is a change of the color of the enamel, the appearance of cloudiness at first and then a white carious spot. The pulp teeth lose the usual shyness and occur a grayish tint. The color of tooth can and will change under the influence of external factors like smoking, chemical treatment, or some other painting means like strong tea or coffee. Pay attention to the shape of the sides of the teeth. Deviation from the usual form is associated with treatment or abnormality. It is known that some forms of dental anomalies, like Catchinson's teeth and Fournier's teeth, are characteristic of certain diseases. Temperature diagnosis. So the temperature diagnostic is the determination of the tooth reaction to temperature stimuli, and it's one of the oldest physical research methods. The teeth have cold and thermal sensitivity. Usually, heating and cooling cause an appropriate sensation and indicates the normal state of the pulp. With its inflammation, the indifferent zone narrows, and already with minor deviations from body temperature, up to 5 or 7 degrees, there is some aching pain occurs in the teeth. Cold water, dry ice, or dichlorfluoromethylene, hot water or heated gutta perca can be used as an irritant. The irritant is placed in the area which are near the pulp of the tooth. Usually it's the cervical region. The thermal threshold of pulp irritation is usually very high, so this method is inaccurate. This result of thermometry is affected by the thickness of the dentin as well, and the presence of replacement dentin. So this method is useful, but it cannot be used as a single method, and we should always use another methods to determine the state of the teeth. Next method is the percussion. Percussion, or tapping on the teeth, is used to determine the condition of the periodontum. We use a tweezers or a backside of a probe, tap on the cutting edge or chewing surface of the tooth. If there is no inflammation in the periodontium, the percussion is painless. In the presence of an inflammatory process in the periodontium, strokes that do not cause discomfort in healthy teeth will cause a painful sensation in the teeth with inflammation. Percussion should begin with normally healthy teeth, not cause severe pain, and allow the patient to compare the sensation to a healthy and damaged teeth. Palpation is used to determine swelling, tumor, compaction, mobility of organs or tissues in the oral cavity. The method of palpation depends on the localization and size of the lesion. In one case, it's carried out with one index finger, and in another, the mucous membrane is taken into folds with 2 fingers. In some cases, the palpation of the cheek tissues is produced by the index fingers on the right and the left hands, and one finger is outside and the other is from the inside of the oral cavity. The palpation is recommended to begin with an intact area of the mucous membrane and gradually approaching the lesion. Thus, the border of soreness, compaction, is more accurately determined. The filling ulcers of the oral mucosa is an important diagnostic value is the determination of the density of the edges and their soreness. The absence of soreness and palpation of the ulcers with dense edges should cause suspicion of malignancy or syphilitic ulcer. Determination of teeth mobility. The teeth mobility is determined by tweezers and by swinging the teeth. The teeth have physiological mobility, which is normally almost imperceptible. However, with damage to the periodontium and the presence of exudate in it, pronounced mobility of the tooth occurs. There are 3 degrees of mobility. First degree is displacement in the vestibular oral direction, second degree displacement in the vestibular oral and lateral direction, and third degree displacement along the axis of the tooth. Currently, objective methods for measuring the magnitude of tooth deviation from the axis are proposed, but they have not yet been introduced into practice. Additional research methods. The most leading method of additional research is the X-ray examination, and there are many X-ray techniques: intraoral and extraoral radiographs, tomograms, panoramic radiographs, orthopantomograms, radiovisiograms, and computer tomograms. The most widely used methods are intraoral, radiograph, and orthopantomogram. Nowadays as well, one of the most commonly used methods are the computer tomography. Methods of reading intraoral radiograph. So first is the evaluation of the quality, the contrast, sharpness, and projection disorders. Next is the determination of the scope of the study, jaw or groups of teeth. Next is the analysis of tooth shadow, the state of the crown, the presence of carious cavity, filling, a defect in the filling, the ratio of the bottom to the carious cavity and the cavity of the tooth or the pulp cavity. Characteristics of the pulp cavity: the presence of filling material on denticles, root condition, the quantity, shape, size, and contours, the characteristics of root canals, the width, direction, degree of filling, assessment of the periodontal cleft, the state of the compact plate of the hole, evaluation of the surrounding tissues, the state of the interdental septum, the presence of restructuring in the interosseous texture, analysis of the pathological shadow. The orthopantomography is a panoramic image of a patient. You can see it in the upper image, and it's possible to obtain a 30% increased image of the curved upper and lower jaw in one film or one photo. It allows you to compare the state of the bone tissue in different areas. This method is informative and it's recommended to use for injuries, inflammatory diseases, but it can cause some curvature to the teeth on the image, and it's not possible to accurately determine the size of the root and the shape of the teeth. The computer tomography is a method of examining the teeth using a three-dimensional 3D picture of the teeth with high resolution. This method is more informative than two-dimensional radiography or pantomography, and it includes the three-dimensional recreation of the jaw, and we can see all of the information of the teeth with slices of up to 0.5 millimeters. And this method is recommended for diagnosis of the condition of the patient. Autofluorescence stomatoscopy. This technique is used to conduct autofluorescence imaging, luminescence stomatoscopy of the oral cavity. The autofluorescence stomatoscopy allows you to identify abnormal fluorescent luminescence associated with the presence of inflammatory, precancerous processes, and oncological diseases. When illuminating the oral cavity with LED radiation of the APS apparatus, the endogenous or autofluorescent glow occurs, which can be observed through special yellow glasses under darkening conditions. The normal oral mucosa has a green glow. With development of pathological conditions, the nature of the glow changes, and the pathological foci or precancer or leucancer have abnormal glow, usually the red glow. Detection of an abnormal glow allows you to show oncological alertness during the initial examination of the patient. Electrodontodiagnostics. The electrodontodiagnostics allow you to get an idea of the state of the pulp and tissues surrounding the tooth. The basics for the use of electric current is the ability of living tissue to come to an excited state under the influence of a stimuli. The minimum force of irritation that causes excitation is threshold. With the pathology of the pulp, its excitability changes. The use of electric current for diagnosis is common. Its strength and duration of action is easy to dose, and you can use the current to repeatedly without damaging the tissues. So this method is advised for use instead of the cold reaction of teeth. Instruments used to treat a dental patient. First is the excavator. In conservative dentistry, excavators are used for gentle preparation of the dentinous wall of the caries cavity, smoothing of overhanging edges, ledges, and removing detritus. The working part of the semicircular excavator has an oval or rounded shape and a pointing cutty edge, which ensures the effective separation and evacuation of certain debris. To curettage of deep caries cavities, spoon-shaped excavators with a long cutting edge of uniform width and a rounded tip are used. This form of the working part facilitates and makes it more efficient to control the tooth in conditions of limited visibility. Planes. The planes and its modifications are one of the most popular tools in dental practice. The main field of application of the plate is the introduction and preliminary placement of filling material in the treated caries cavity. The choice of working tool is dictated by the size, shape, and location of the cavity. Currently, for the manufacture of planes, as well as of the tooth, they come into contact in the process of working with the filling material. Not only oxidized medical steel is used, but also special high-tech coating materials, which reduce the adhesion of composites to the surface of the tool and prevent staining or restoration with medical particles. The condensers or stoppers are used for injection, distribution, and preliminary formation of the applied mass of filling material. The working part of the stopper has several structural options designed to work with various types of filling materials and caries cavities of any configurations. Filling of cavities localized in the contact zones and on distal surfaces should be carried out using 3-angle reversible condensers, in which the total angle of inclination of the working part relative to the handle, which is 110 degree,